By this time next month, Illinois legislators are set to be back in Springfield. The major issue on their agenda so far, the coronavirus and what Illinois can and should do when it comes to vaccinations. Amanda Vinicky joins us now with more. Amanda.
Brandis, Chicago's Public Health Commissioner Dr. Allison Arwady says that the situation of COVID cases in the Midwest is not looking good. She is recommending actions taken throughout the pandemic, wearing a mask indoors, staying home if you're not feeling well. Also, proof of vaccine to go to places like a bar or restaurant. That could be next.
Might we begin requiring proof of vaccination for more activities in public spaces? Yes, I think we might. I certainly am more interested in that than I am in needing to, do some of the major shutdowns. And theaters and many other spaces have already been doing this, but it is certainly something that if, as this increase is continuing and perhaps with a new variant, we may do more of.
It's one method of enticing people who so far have not gotten the vaccine to get that COVID shot. State Representative Jonathan Carroll, a Democrat, has another idea. He's proposed legislation that would have anyone who refuses to get the vaccine and who then ends up hospitalized or with other health problems because of COVID to have to pay those health care costs out of pocket.
I think it's proven to be safe and effective. And it's frustrating for those of us that are vaccinated that others are choosing not to be vaccinated.
Carroll says this is not a government mandate. It would remain individuals' choice, but he says actions have consequences. And if you choose not to get the vaccine, this would be the consequence.
That I'm not a punitive person. I don't want to punish people. At the same time, it's very difficult for me to understand why people aren't taking this vaccine. Again, it's been out for a year. It's proven to be effective and it's proven to be safe. I mean, my limbs haven't fallen off. I haven't had Bill Gates following me around. When polio was out there, people took the polio vaccine. We were able to eradicate polio. And why is this still in 2021 still a conversation?
As it stands, he says those who are not vaccinated are contributing to a clogged healthcare system. And he says that will cost everyone through potentially delayed care, also financially as premiums stand to increase. A study by the Peterson Healthcare Center and Kaiser Family Foundation found that over the summer, from June to August, preventable COVID-19 hospitalizations among unvaccinated adults cost over $5 billion. Meanwhile, another piece of legislation in Springfield taking the opposite tact. Republican State Representative Adam Nieberg has introduced a measure that would forbid discrimination against anyone who chooses not to be vaccinated out of religious or personal beliefs. He says COVID should be taken seriously.
It is understandable that our leaders would want to fight this with every tool in their arsenal. But public health should not be an excuse to take away our freedoms and liberties. We should take steps to promote public health, but we must do so in the context of our rights as Americans.
Now, in Illinois, Republicans in budget talks often complain about unfunded mandates that the government passed down. When asked about the costs that Illinois residents might have to pay because of those who don't get the vaccine, here was his response.
Many breakthrough cases, and all we're talking about is vaccination status. That's all we're having discussions over. I am ready to have a discussion across the gamut of COVID-19 mitigation standards, and we should not discriminate any American because of their vaccination status, period. Any other questions?
Now, Nieberg is in the minority party in the General Assembly. He even admits his legislation may not get far. Carroll's might not either, and he says this is at least a starting point of a conversation. He's open to other ideas because there are some legal issues right away. The Affordable Care Act does prevent discrimination based on someone's health care status when it comes to insurance. Carroll says, however, there are other options to be considered, like the surcharge that Delta Airlines has instituted on non-vaccinated employees. He points out that life insurers can charge a surcharge if somebody, for example, is a smoker or is obese. With that, Brandis, back to you.